Hello, my name is Dr. Paul Barron. I'm the Chief of Breast Surgery at Lenox Hill Hospital and the Director of the Breast Cancer Program there. And Lenox Hill Hospital is part of the Northwell Health System. As many of you know, October is Breast Cancer Awareness Month. The reason we have a month dedicated to breast cancer is to educate people about breast cancer so that they know the importance of screening mammograms. Breast cancer is very common in the United States. It affects over 250,000 women each year. So we know if we do screening mammograms, we will detect the cancer more often on the early side, and therefore the cancer will be detected early and treatment will be a lot less severe. But what a lot of people don't realize is that breast cancer also affects men. Unlike women, which is 250,000, with men it's only about 2,500, so a very large difference. And because of that, we actually don't have an effective screening test for men with breast cancer. Also, interestingly, the incidence of breast cancer in men has been increasing. And part of that increase, we think, is due to the aging population because it tends to occur more often in people as they get older. So the purpose of this session is to talk about the importance of breast cancer in men, how people need to be aware of it, and things they can do to detect it, and things they can do for treatment. So today we're going to highlight a wonderful gentleman named Mr. Marvin Wax. We'll talk about his excursion or his journey through the breast cancer experience. And as with women who have their breast cancer usually detected on a mammogram, in men, since we don't have mammograms done on them, they usually present with a mass in the breast. And his case is very typical of that. And in fact, he found the mass about a year ago, and he'll talk to you about why he waited to have it evaluated. But when he did come into the office, I biopsied the mass, and it came back as cancer. And based on that, we went ahead and ordered a screening mammogram on him, or a diagnostic mammogram on him. The first image I will show you is an example of a mammogram in a normal male. As you can see, the tissue is pretty uniform on both the right and the left. There are no masses, no calcifications, nothing at all worrisome or suspicious. However, unlike this case, we then obtained what's called a contrast-enhanced mammogram on Mr. Wax. And this is a very special test that we do at Lenox Hill Hospital, again, part of the Northwell system, where contrast is given with the mammogram, and it highlights the mass very well. And so in this situation, you see the obvious mass in the left breast, but to our surprise, he also had a small mass in the right side. So the mass that he presented with was on the left side, and he also had a mass on the right side. The right side was then biopsied and also showed cancer. And for those of you who are wondering, he has no risk factors for breast cancer. He has no family history. He has no reason for having breast cancer. So Mr. Wax will now talk to you about his journey on how he came to this point and where the plan is going forward. And he has his lovely wife, Sandy, here, who will talk about its impact on their family and on him. Thank you.
Am I ready? Okay. Hi, my name is Marvin Wax. I'm a 90-year-old male. Excuse me. A 90-year-old male with breast cancer. And that's really the end of the story. But the beginning is much more important. In 2018, I noticed that when I took a shower, I found a lump on the left side of my breast. But knowing that men don't get breast cancer, at least I didn't think so at that time, I just ignored it. And because it didn't hurt and it didn't look terrible because of on my chest, you couldn't even notice it for a long time, I just ignored it and did nothing about it. Then in 2019, July of 2019, I went away with my family to Barcelona. And I sort of promised myself at that time that if I still had that lump, that I would go to a doctor when I came back. But of course, when I came back, I still didn't go to the doctor because I was embarrassed and ashamed that at this stage of my life that I had to have breast cancer. And so not until August of this year, when I went for my normal physical at my internist, did he notice it and asked me, suggested I see a breast cancer doctor, recommended Dr. Paul Barron, which I'm very pleased that he did. And of course, his biopsy that he took showed very definitely I had cancer. And so I had a number of tests after that, I had a mammogram, I had an ultrasound, I had a PET scan, I had a CAT scan. I was lighting up the room. I had so much radiation. But I'm just saying that what I only hope and pray is that my fellow brothers, male brothers, would understand how important it was for early detection, which really is the best medicine. It saves lives by doing that. And I ignored it. And don't follow my footsteps because it was the wrong thing to do. Luckily, I'm being treated now with tamoxifen, and I may or may not have surgery yet, but I'm hoping that it won't. So please, if you see something, do something. Thank you.
Hi, my name is Sandy Wax. I am a breast cancer survivor, and my husband, who never keeps a secret, had kept a secret for over a year because he was even ashamed to tell me about it, which was such a foolish thing because I would have dragged him to the doctor right away. But I feel that men are so foolish because they never think that these could happen to him. But cancer doesn't know whether you're a male or a female. And as my husband said, please, please go and be tested. And I also want to thank Dr. Barron, who's been so wonderful to us. He's the kindest, most feeling man. Thank you.
Thank you. That was beautiful. So we are here to answer any questions that may come up. That was a beautiful summary of your experience, Mr. Wax and Sandy. Thank you, and Marvin and Sandy. So if you have questions, please feel free to ask, and we're here for you.
And what was your reaction when you actually got the diagnosis, even though you kind of suspected?
Well, I certainly didn't expect breast cancer, but by the time I went to see Dr. Barron, in my own mind, I pretty much felt that it probably was, although I hoped it wasn't. And when I saw Dr. Barron and he told me that from the looks of my chest, the lump, that it probably is cancer, but we're going to do a biopsy to make sure. And that was on a Thursday. On Monday, he called me and told me the good news that I had breast cancer. And from that point on, it was a roller coaster ride through Lenox Hill Hospital and all kinds of tests. And I got to tell you, I really envy women because when they have a mammogram, I got to tell you, it must hurt a lot because it sure hurt the hell out of me when I had it.
Okay, well, we'll just take one more question. Would you, Mr. and Mrs. Wax, consider this, how would you consider this as a family issue?
Well, it's a very big family issue because we have two sons that also have cancer, but not in the breast. So we're really into that thing. And I know when we found out, Marvin and I found out together after he took his mammogram, and they thought that he really has a lot of problems. We both cried in the room. So that was how we felt about it. It's just a terrible thing, but we'll get through it.
All right, one more question. The question is, you don't have a genetic mutation for breast cancer, is that true? And also, Mrs. Wax, when was your breast cancer diagnosis? So first, Mr. Wax, about the genetic, and then Mrs. Wax, when?
Take your mask down.
I'm sorry, I'm not sure I heard the question about the genetics.
Do you have a genetic mutation?
I did have a genetic test taken, and thank God it came back negative, which I was very, very happy about, which was, one check for me. So thank God. My wife.
I have a negative for the same gene, which is good because of my granddaughter's having a baby now, so she doesn't have to worry, which is good.
And when was your diagnosis?
My diagnosis for breast cancer was 2007. I had radiation, and I was on tamoxifen for 5 years, and I'm really fine.
Anything else?
Can I?
Can you just sit
I also like to use this opportunity to emphasize the importance of mammography this month. Month is Breast Cancer Awareness Month, so it can be done certainly throughout the year. During COVID, people were discouraged from going in for screening mammograms, but now as we've been coming out of COVID, most centers have steps in place to minimize the risk to the patients, but we have a problem going on where the percent of mammograms being done is down over 25%. So many of us in the healthcare field are worried that we're going to be finding more advanced cancers because people are delaying getting their mammogram. And obviously we're talking about women with screening mammograms here. So please get your mammogram. Most places are back open and running full steam ahead. And I think it'll save your life, as everybody knows that.
We do have one more question. Has going through this experience brought the two of you closer somehow?
Well,
I don't know if we can get much closer.
I know.
we're very close.
We've married 68 years. We were boyfriend and girlfriend for 4 years before we got married. So that's good 72 years, and we're just happy that a few good things are happening. While we're going to become great-grandparents for the first time, so I'm hoping that at least till April I'll be here. And then we want to, in 2022, we want to celebrate our 70th wedding anniversary. So I'm looking to Dr. Barron to keep me going.
How much in 2022? 70?
70 to 2022.
So that was wonderful. Thank you so much for bringing awareness about male breast cancer. And obviously, everybody knows Breast Cancer Awareness Month, so please get your mammograms and do what you can to help the cause here, to finding cancer early and improving everybody's health. Thank you so much.